So our solution is Uppstroms, which is social risk prediction machine learning app for electronic health records. So if we think about what are the real drivers of health and well-being, those are social determinants and behaviors. Where we live, work, play, our individual behaviors, our social situations and contexts, our environmental situations, those are infinitely more important to our health and well-being than genetics or medical care alone. The problem, though, is these are the exact sort of factors that healthcare organizations are not equipped to address well. Doctors and nurses are generally not trained on how to address these social determinants issues. Doctors' offices and hospitals are not organized to systematically screen for these issues. And screening is not always effective, time efficient, or often useful for these issues. So that's what Uppstroms is. It's about looking upstream to identify patients in need of services that address the social factors and turning them into actionable solutions. So we have our machine learning algorithm to which we input diagnosis and utilization data from electronic health record. We layer on environmental and social context information about the patient. We then add public health data sources that describe the health status of the patient's area and general trends. And then we also add statewide health information exchange data, so we have longitudinal behaviors and diagnosis and encounters from beyond a single institution. And what we predict out is need of a referral. Need of referral to the types of service providers that can actually address social determinants. So we predict out to social workers, behavioral health, dietitians, financial counseling, patient navigation, pharmacy assistance, and medical legal partnership. And we do all of this in a vendor-neutral approach. So risk scores for referrals are available every day before the very first patient is seen, so organizations can identify those patients most in need and make efficient and effective decisions around the referral. Clinics send information to our organization. It is compiled. Risk scores are calculated. Those risk scores are scaled against the patient population. So an organization sees their highest risk patients amongst the patients that they're used to seeing and taking care of. That information is sent securely back to the organization where all clinic staff and providers have access to individualized risk prediction scores for each of their patients before anybody walks through the door. This is a feasible solution for 3 reasons. 1, our performance is in the clinically useful range of prediction algorithms. It fits within the standards and expectations for things like mortality and readmissions. We have positive impact. We have a prospective clinical trial that found we had a 65% increase in social work referrals when our application went live. And we saw an increase in the rate of kept appointments among those who were referred. So people who were referred were more likely to keep those appointments, which is more effective and efficient use of resources. And it's in use every day. 9 primary care sites get risk score information delivered to them before the clinics are open, and we're augmenting it with a graphical display and on-demand interaction to the EHR. Our team is composed of informatics, clinical care, population health, public health, and healthcare management experts, and we are surrounded by strong clinical partners and good institutional resources. The market opportunity to address the social determinants of health is significant and substantial. Addressing the social determinants of health can save a health system up to $2.4 million in avoided hospital costs alone. And if we think about it, nearly every single hospital is working to address patients' social needs, and most are struggling. If we extend that, any organization that is at risk for patient care and population health, payers, health systems, hospitals, medical groups, all of them need to address the social determinants of health and need an innovative solution. So what is Uppstroms? It is a solution for a nationwide challenge, a solution that is demonstrably effective and feasible, and the ROI will exceed the investment.